your environment can also affect and help to develop hypertension and diabetes.
Yeah, absolutely. I mean, here I had thought I would do work on different parts of the project than I actually am, and it's just through, one of the most important things, and it of course depends on where you are, is just to use the resources around you. A lot of it is related to more non-communicable diseases, more chronic diseases, that kind of thing, and things that develop over time based on maybe exposures that people have. So a lot of the research that I've done in the past is maybe related to like workplace exposure. Something that was interesting to me and wanting to get involved. I think it's really important to kind of like be curious and want to go and ask people, what are they doing and how can you get involved if it's something you're interested in, and you can kind of really figure out
Hola a todos, sean bienvenidos una vez más al podcast Mente Médica, auspiciado por la consultoría Medicina Académica. En este episodio estoy muy emocionado porque voy a entrevistar a mi amiga Melanie, ingeniera, investigadora y actualmente estudiante de la Maestría en Ciencias de la Salud Pública en la Universidad de Johns Hopkins. Ella ha estado los últimos 6 meses realizando investigación en Perú y el día de hoy nos va a comentar cómo ha sido esta experiencia, por qué y cómo logró ingresar a la Universidad de Johns Hopkins y también qué otras recomendaciones tiene para personas o estudiantes que quieran hacer investigación. Así que empecemos con este podcast.
You were telling me that you were running, that you have run a lot of here in Puno.
Yes, yeah.
How has been that?
It's been tough. Of course, we're so high up. I think we're at maybe 3,700 meters or so. And I've never really ran in the mountains before. So it was definitely tough just starting, and I had to take a lot of breaks and, just to catch my breath. But now I've been here for 6 months, and so I've gotten a lot better. I'm a lot more used to it. So I'm actually kind of excited to go home and back to sea level, and hopefully it'll pay off a bit running there. But yeah, it's been good.
Great, 6 months that you have been here. Wow,
Yeah.
long time.
Yeah, it's gone by quick though, kind of, in some aspects. But
Are you gonna miss Puno?
I think so. It's been really nice. It was definitely an adjustment at first, but I've since then really started to enjoy being here. The people are wonderful, and it's just beautiful. It's a beautiful city, and the team that we work with has been great. And yeah, I really liked it here. Mm-hmm.
Yeah, I also remember when I just arrived that first weeks are really hard,
Mm-hmm.
to get used to the altitude and all of that. But after that, it's quite calm in general.
Yeah.
And you were telling me that your background was in chemical engineer.
Yes.
Yeah.
Yes.
How did you decide for that in college?
In college, I actually was pretty undecided when I was in school, and so that's part of the reason why I chose chemical engineering specifically. I'd always really kind of liked the STEM field and math and science, and had always done pretty well with it in school. And then chemical engineering is just very broad. There's a lot you can do with that degree. So I thought, since I really didn't know quite where I wanted to go yet, that might be a good fit for me, and it was good. It was nice and challenging, and I did a couple concentrations. So I concentrated in pharmaceuticals and life sciences. So I kind of, went more towards like the biology side. Took a lot of biology classes. Yeah. So I always kind of thought I would do something in health, but not exactly where. So yeah, I thought it would overall be a good fit. But
Great. I think that's very common in United States, not to do the college, and that it's not gonna to define your future. No? You can do different.
Yeah.
You can take different options. No?
Absolutely. Yeah.
Yeah.
No, I definitely. I think that's maybe a lot of people, like, you go to school so young and you don't really know quite where you want to go.
Yeah.
And so you just kind of try and find something that will give you options of things you could do. Yeah. And
you were telling me that you like a lot Ohio, right?
A lot of what? Sorry.
Ohio.
Oh, I hate Ohio. Never go to Ohio. If you have the opportunity, say no.
Okay, tell me why what happened with Ohio exactly? You have been telling me all these months.
So I'm from Michigan, which is Michigan and Ohio are both in the Midwest, and Michigan's just north of Ohio. And there's I don't know, there's always just been kind of almost a rivalry between the states. I don't know if it actually really goes back to the universities in each state. So I went to the University of Michigan, and they have a huge rivalry with Ohio State University. So I just throughout my entire time at school and even growing up, being surrounded by people that graduated from universities in Michigan, everyone just hates Ohio, and also Ohio in general. It's just cornfields. There's nothing there.
It's very boring.
It is. There's a lot of great places in the U.S., but would not recommend Ohio.
Okay, but Michigan is great.
Michigan's great. It's a beautiful state.
Did you study college there?
I did. Yep. So I did my bachelor's degree at the University of Michigan.
Excellent. And how did you get into Hopkins?
So it actually was by chance. I had never actually planned to apply to Hopkins. And then I went to, in the United States, and I don't know if this is common in other countries as well, but they have these days where you can go to basically these fairs, and 6 or 7 universities will have representatives at those fairs, and they will just kind of talk to you and explain what the program at their school looks like. And so I went to a fair where there is someone from Hopkins, and I had just gone to see other universities, that were there. But I went and listened to the person from Hopkins speak, and I really, really liked the program that they had and the way she explained it. So I'm doing a Master's of Science in Public Health and International Health at Hopkins. And so as part of that program, the first year is all classes, and it's pretty quick. You get new classes every 8 weeks. But then the second year, you have an opportunity to do a practicum. And so you can use that opportunity to travel, and that's what I'm doing here is my practicum, and really get a lot of field work. And you can spend, up to the entire year doing it, or you can even start a job and just continue after you graduate. And so I just thought, especially I went to university during COVID, and so I didn't get a lot of opportunities to go and work somewhere. So I thought it'd be really nice to have, a really long given period of time where I can go and get a lot of work experience, and that can kind of help me figure out what I want to do in the future.
Great. Yeah. So that was the main point that why you decided to go to Hopkins, or there was something related with public health that motivated you?
Yeah, so I originally decided to get the degree in public health. So I did, like I said, like we've talked about, I did my bachelor's degree in chemical engineering, but I also did a supplemental studies in public health, and did a work on a study through the University of Michigan. And I had a really great professor who taught a toxicology class there. And so I got involved with that research study through him, and I really, really enjoyed it. And so I thought, so it was within my last year or two at Michigan that I decided to go get the master's degree. And it was because of that study and that professor. And so it was them that really convinced me that, maybe I am really interested in public health and wanted a degree and could try and combine, the public health degree and the engineering degree somehow, hopefully in the future. So it was through that I got involved in public health.
That's very interesting option. That maybe in countries like Peru, in general, there is still not very developed to combine. There are some programs that have started, like the biomedical engineer started like 5-6 years ago, maybe a little more.
Yeah.
But they are just starting. We do not have still strong programs that combine engineering and biomedical science or something like that.
Yeah, and it can be really challenging because your one degree takes up so much time, so it's hard to get involved. I just happened to get lucky, but I think it's difficult to kind of explore other fields when you're so busy with your degree already. Absolutely.
Right. And Hopkins is one of the most competitive programs in public health.
It's a very big school of public health. It has a lot of resources and it's very big.
How was the process of admission? Do you consider it very difficult or?
It wasn't too horrible. I think in the United States for Masters of Public Health programs, and I think even PhD programs, I'm not actually, that might not be true, but you apply through a portal, and so you write. So it's very standardized. So every school of public health is on this portal, and so you kind of apply to each of them all at once. And so some of them will have, their own essays that you want to write, but it's pretty similar for all schools. I don't think Hopkins was too much different than other schools. It might just have had a couple of different essay requirements. But I think as far as graduate programs in the United States, it's not too bad. You didn't have to do an interview or anything, so it was so it didn't make it too difficult. Okay. But yeah, it can be a little overwhelming when you think about what schools to apply to and all the essays you need to write. But
did you apply to other schools also?
I did, yes. Okay. Yep. So let me think. I applied to maybe 6 schools, if I remember correctly.
Yeah. Hopkins was your first option.
Yeah, I did really like Hopkins. So.
Great, excellent. Now you're here. You have been 6 months here.
Mm-hmm.
What have been your experience in general with public health in a context like this?
Yeah, so this is my first time doing research in internationally, and so it was definitely an adjustment to come here and so the project that I'm working on, it's actually the same project that you are working on, but there's 3 different universities that are kind of have their hand in this project, so it can be kind of overwhelming. There's 4 PIs, and so and the team is just really big here, and we've got a couple different studies going on as well, so trying to navigate that all and just showing up in a different country, and you get here and you're like, okay, now I'm here, what do I do? So it was interesting the first couple of weeks trying to meet the entire team and figure out what kind of role I wanted to play, and our study, for better or worse, is huge, so there's a lot of different aspects that you can get involved in. So I think that was another part of it, was okay, what here am I really interested in? So for me, I work a lot with the community health workers that we have, and I also do a lot with the environmental side of the project, and that's something I've always been interested in. I have a background kind of working on different environmental projects, and so I really tried to work my way into that and started going on visits with them and doing data analysis for that side of the team. But yeah, I think it's been nice and a nice experience. It's very eye-opening. Like, research moves pretty slowly, and so I think that was something I didn't really realize before coming here. And so coming and witnessing that, especially with all the people that are involved in this project, it could be a little frustrating, but at the same time, I think having all those people, there's a lot of people to learn from, and like I said, a lot of things that you can get involved in that, and it's been good overall, I think.
Really, really interesting. I think that is something that when people are starting research, realize that projects sometimes can be a little bit slow.
Yeah, absolutely.
And that there are a lot of factors that can influence that. So, I totally understand. What is like the most interesting experience that you have lived here, or?
I think this goes back to me having not worked abroad before, but I think just going at the beginning of my time here, I would go with community health workers or the environmental team to a lot of households, and we just knock on the door, and but just to just see a totally different way of life from what I'm used to back home, I think that's been really eye-opening. And a lot of what I do is with the community health side, community health worker side of the project, I've been reading through a lot of the transcripts and just reading about people's daily habits and what their lives are like. A lot of people here are farmers or work out in the fields, and that's something that's very new to me. So I think that's been very eye-opening of just like, I'm only here for a small period of time, but just to really see an entirely different world has been really interesting, and I've actually really enjoyed it. Yeah.
Yeah, I also had the same experience because to see a totally different reality and totally different challenges that people face here is really interesting. What do you have any advice for another person that wants to do an international research experience?
Yeah. So I think there maybe are two sides to this, but I think coming here, I had thought I would work on different parts of the project than I actually am, and it's just through going and talking to people and seeing what other people are up to on the team and deciding whether or not it was something that was interesting to me and wanting to get involved. I think it's really important to kind of like be curious and want to go and ask people, what are they doing and how can you get involved if it's something you're interested in, and you can kind of really figure out, what you want to do, and by doing that, and don't just, settle into one spot, but try and keep your options open and talk to as many people as you can about different opportunities you can get involved in.
That's a really important point, I think, because in research a lot of things depends on how do you get involved. How do you ask if you can participate in one thing or another? No?
Yeah.
Yeah. Now you are coming back to US.
I am, yes.
Well, first I wanted to ask you, in which research have you been working exactly?
Through the study or?
Yeah, or in general?
So I guess with the engineering background, of course, I've been doing a lot of quantitative work. I'm really interested in environmental health, even though my degree is technically more infectious disease related.
Can you explain in general, what is environmental health?
Yeah. So it's just how different it's kind of what it sounds like, but there's a lot of moving pieces to it, but just how the environment affects people's health. So that can be, through the air quality, through water and, water sanitation and health. A lot of it is related to more non-communicable diseases, more chronic diseases, that kind of thing, and things that develop over time based on maybe exposures that people have. So a lot of the research that I've done in the past is maybe related to like workplace exposure. So if people are working, for example, in construction and, like what kind of toxins or chemicals they're breathing in all the time, and how maybe, 20 years down the line, if they work at that job for decades, how that might impact their health. Yeah.
Yeah, no, it's very interesting. Yeah, continue, please. Yeah.
So I'm from Michigan, and in Michigan there's the Flint water crisis, if you've heard of that, and that was related to lead being in the water and how that impacts development and that kind of thing, was really what I was focused on, and I helped do some data analysis with that, so it can be a lot of different things. It's a very broad field, but it's something I'm very interested in, and maybe something I'll try and combine, my 2 degrees with and get into that field a little more. So I've done kind of a mix of things, I guess. But here, of course, we're focused on diabetes and hypertension, more chronic disease and interventions related to that.
Because environment can also affect and help to develop hypertension and diabetes. No?
Yeah, absolutely. Yeah. Yep. So, and that's kind of, we're looking at, for example, I'm doing data analysis on how people's exposure through, depending on what kind of stove they use, if they use a biomass stove versus non-biomass stove, and how that may impact their blood pressure and ultimately hypertension and diabetes. Yeah.
That's great, really interesting. And what are your plans now?
So I'll go back to the U.S. I'm not quite done with my degree, so that's step one.
Okay.
So so I'm planning. So as part of the degree, you do your your practicum, and then you have to do what's called a capstone and write a big paper. And you don't necessarily have to write it on your practicum. But at this point, I'm planning on writing it on something related to this project. And it's just kind of like a thesis paper. It's just like a 30 to 50 page paper where you can kind of do like your own sub-study or a literature review, or it's pretty open-ended. So you've got options. And then hopefully I'll graduate in May. And then from there, I'm thinking I'll go and work for a while. I'm thinking maybe someday I'll come back for a PhD, but I would like to take a couple years and work in the field. So I've really enjoyed working abroad, and I think I'd like to continue that. But as far as where I'll be or what I'll be doing, I'm not quite sure. Like I said, I'm really interested in environmental health. So I think I might look for a job kind of related to that. But we'll see. Yeah.
Great. So you plan to continue in graduate school?
Possibly. We'll see. We'll see how much I like being out in the world, and then decide if I want to come back. But we'll see.
Excellent.
Definitely not saying no.
Yeah. In research, there are definitely opportunities that are worse.
Absolutely.
A lot of paths that you can follow. Any advice that you have for young researcher, for example, or someone that wants to make or are interested in health biomedical science?
I think one of the most important things, and it of course depends on where you are, is just to use the resources around you. So for example, if you're a student, reach out to professors, and this goes back to maybe what I was saying here, just keeping your options open and reaching out to people, and same, at school, or if you're working or whatever, and just, if you think that you might be interested in something, that it doesn't hurt to reach out, of course, and you never know what you can find. And so I think just using the people and the places or the things around you to kind of figure out the best fit for you. And of course, don't spread yourself too thin by taking on too much. But I think that's just the best way you can find some really great things and great projects and people to get involved with by doing that. And you never know what's out there. So, yeah.
Excellent. Excellent. Thank you very much, Melanie.
Thank you.
We are really gonna miss you.
I'll miss you guys too. I'm sad. I'm gonna miss Puno, but it's been great here.
Well, and soon Kristen is going to leave us also.
Yeah.
December is a very sad month. For Christmas.
Everyone's leaving.
Okay, excellent. Thank you.
Thank you.
Muchas gracias, amigos, por haber visto este podcast. Recuerden que en Medicina Académica seguiremos hablando mucho más acerca de salud pública, carrera en investigación y todos estos temas que tanto nos interesan. No olviden suscribirse al canal, dejar sus comentarios y nos vemos en una próxima oportunidad. Hasta luego.